and Chinese meditation practices, and how this all went together with communism. So working on the WHO is really another kind of place, the last place where you'd be looking for spirituality. A huge institution, a huge bureaucracy, but there really are some interesting things to find there. So what we found before we started looking at COVID-19 is that obviously the WHO has a very broad definition of health, and this has been subject to much debate. And the reason why it's so broad overlaps, among others, with some spiritual themes in the early 20th century public health. Then we looked at the attempt in 83-84 to introduce a spiritual dimension of health into the Health for All initiative, which Halfdan Mahler strongly supported. He was at the DG at that point. So there was the Health for All initiative, the attempt to roll out primary health care for it worldwide. And in order to succeed with that, there were a lot of people saying there needs to be a spiritual dimension because we can't do it without faith actors. At that point, the World Council of Churches had already been doing a lot of work, really pioneering the whole PHC approach. So this was in 83-84, the first time this really became a big issue in the WHO. Was twice discussed in the World Health Assembly, whether to add a spiritual dimension to the Health for All initiative. And at that point, the Eastern Mediterranean member states were very much in favor. And then since then, there have been occasions. There was within palliative care, some acknowledgement that when people die, spirituality must become important. Then there was a quality of life measure that came out was developed in the late 90s, the WHO. And for that, they developed a module on spirituality, religiousness, and personal belief. So for that, actually, WHO made a consultation with religious experts to really figure out how to understand the influence of personal beliefs on quality of life. And then there was in the late 90s also, around about the same time, an attempt to reform the definition of health in the preamble to the WHO's constitution. And there again, there was, it failed, it was a failed attempt, but there was again some lobbying to include a spiritual dimension, this time in the very preamble, not just in the Health for All initiative. Yeah, and then another context in which WHO has touched on this topic was within traditional medicine, because traditional medicines are, very, very, very often linked with religious beliefs or religious practices, or what is understood to be religious practices by Western medicine. So in this context, that WHO has occasionally taken up this topic, and in recent years there has been a slight opening towards a slight recognition that traditional medicine is not just a interesting for pharmacological reasons, but also has its own kind of epistemology attached to it, which has its own validity. By far, the most significant time WHO has really taken seriously faith-based communities was, in my opinion, what just happened with COVID-19. And this was really the first time, from what I've seen, pouring through the archives in Geneva, was the very first time WHO has really, really sat together at eye level on a table with many, many, many faith-based actors, and very humbly asked them, what should we do? And this is something which is unprecedented, I think, and which really drew our attention. And I think it is connected to a broader kind of maybe paradigm shift within the organization, which has been, let's say, catalyzed at least. There were periodically calls for reform within WHO, but with COVID-19 and, you know, with the withdrawal of the United States, with the absolutely enormous suspicion towards WHO, with all the conspiracy theories and all of this, I think WHO has really recognized that it cannot remain a kind of an expert gremium, that it has to really reach out to civil society. And there was just yesterday a webinar that Dr. Tedros held with many civil society representatives, and, you know, he was very, very clear, you know, asking civil society for their advice. You know, he several times said, this is not a Q&A, you know, this is not a time for communities to ask WHO for advice. You know, this is WHO asking, you know, you guys for, you know, what shall we do? You know, he literally said, tell us what he said. This kind of thing only happens once in 100 years. You know, such a pandemic, if even that. And you know, tell us what you think we should do, and I will personally make sure we will do it. So this is really unheard of, I think, because, you know, doctors, and especially, you know, doctors within WHO are, you know, the experts who give advice usually. So I think this is the larger context against which WHO has also written these guidelines. And I'm sending you now these guidelines. They're available open access. And I will just send you the preprint version, so you all have it. You don't have to go chase it online. Let me just find it. Here we go. So I'll drag it into this little chat window here, so you all have it. So yeah, you've got it now. So this, when I saw these guidelines, I immediately realized the significance, because it begins with a few paragraphs, 2-3 paragraphs, where really the language endorsing FBOs. And this is also something which, you know, being used to poring over, you know, reams of documents where, you know, you get one mention of religion or something in the WHO archives, and, you know, it is so dry and so little there, and it's like you get sensitized to just like sniffing, you know, a drop of blood in a pool, you know, and you know, you get so sensitized. So reading this first paragraph was really like, wow, you know, it was really, you know, a waterfall in a desert, you know, after walking through the desert, you know. So this is the first thing I really noticed, that there was a very strong endorsement. And the second thing I noticed was the very much detail that had gone into it. You know, you get a sense when you read a document of how it was written, you know, and reading this, I really got a sense that there was, just by judging by the detail and the practical thought that had gone into it, that there were, you know, that there was very close consultation behind it. And going back in recent history, you know, it was already also reminding me very much of the Ebola guidelines. And the guidelines for Ebola, you know, in Ebola outbreak in West Africa, international health organizations really reached their limits, because the way Ebola victims were treated by the epidemic control teams was really, really problematic in many communities, and even caused a lot of violent backlash and murders. The whole team of people was murdered by local communities who felt that Ebola control teams were basically interfering and stealing bodies and not honoring the religious beliefs that they had. And So I started looking very much into the process that then led WHO to consult with religious experts and anthropologists, and which then led to the guidelines for the safe and dignified burial of Ebola victims. And this was really remarkable, I think, this document. And there is at least one study which says that the safe and dignified protocol really reduced the spread of Ebola and really really put a number to the number of deaths saved by increased compliance with disease control measures made possible by a safe and dignified burial. And so a lot of people from the Ebola, they had experience with HIV. And so there's a group of people who had been working on HIV, who were consulted on the Ebola crisis, and who now were consulted with COVID-19 as well. So there is almost a kind of, let's say, a genealogy or a tradition within WHO where the infectious diseases brought religion to the attention of WHO. And the other tradition is the primary health care, where the idea was really, how do we build, permanent healthcare infrastructure in very, very resource-poor environments, and how do we really care for people from cradle to grave. And in this PHC context, primary health, spirituality first became important. And then with HIV, Ebola, and COVID-19, there was this second kind of stream where it became important. And this is what I discussed in this article. So, yeah, maybe you've already seen the article, or maybe you have some questions. Maybe spoken for about 15 minutes. I have 20 minutes. Let me just think what I can add to this at this point. Well, maybe something else is that it really does seem that there is a trend. It really does seem like there is a development towards a closer relationship. It's very, very long and slow and painful, because it began in the early 80s, and then, neoliberalism and, a lot of historical developments interrupted it. But it really seems like in the last 10, 15, maybe 20 years, also after 9/11, where there was a general move within the United Nations to work more closely with religious communities. And I think within WHO, this is reflected as well, and certainly has been catalyzed very much with this COVID-19 pandemic. And it seems that there is a strong desire now within WHO to not just make this a one-off, but to kind of make some permanent relationship. Because UNAIDS and the UNFPA and some other agencies do have a relationship with faith communities. Either, there are representatives on the board, or they have some kind of advisory council or an FBO liaison role. But WHO has none of that at all whatsoever. But it seems like this may be changing, or at least there is a desire to change that within the greater recognition that it needs to be closer to civil society. So yeah, maybe we can go over to questions, or how would you like to handle it, Olivia?
Thanks. Yeah. So I'll do a brief response this time, and then we'll hand over to questions. Thank you very much for your presentation, and thank you for sharing the preprint of your forthcoming paper with us as well. That's in the chat. I think there's a lot of people on this call who are probably pretty interested, not least because, we've been involved in various ways with some of the other UN agencies' faith engagement work over the years. And that kind of really grounds this linkage and what we're looking at in this question about how an international agency like WHO can think through its own faith engagement. And I think the basic point to start off with is how astounding it is in many ways that COVID-19 represents the most, I can't remember exactly how you put it in your paper, but potentially the most thorough faith engagement that they have taken part in the 70 years of their history up till now. And in many ways, knowing what some of us on this call know about the faith engagement from some of the other UN agencies and the possibilities there, this seems like quite an obvious gap, and therefore a pretty substantial move at the moment. I mean, I think that it's also, for me, it was great to see in the paper the grounding in the work around Ebola as well, and the fact that that's often being cited as a game changer moment. A game changer moment for WHO, but also a game changer moment for a lot of the humanitarian response community who started to take the role of religious leaders and community leaders more seriously within that context. And so I think the first place to start is this link to the burial guidelines. I think that it was obviously around that particular, around that document and the work to get to that document and the use of that document that was so influential in Ebola. In years before Ebola, we had also seen issues. It wasn't the first time that burial became an issue. I remember, for example, hearing quite a lot about dissatisfaction around cholera, burials from cholera, for example, in Haiti, linked to funeral and burial practices. And then we have the issues around cremation that will be possible, dependent on your religious background, whether cremation is within that tradition or not. And that has also come up recently in COVID-19, although it's now clear that cremation is not needed. That was a confusion at the beginning, and we saw some tensions around that. We're seeing news stories from Sri Lanka, for example, the tensions around government decisions to push cremation as the primary mode within these funeral and burial practices. So burial we see is always going to be kind of a particular point of interest, and maybe the entry point in which medical professionals start to come in contact with religious communities, with the religious leaders during the funeral processes. And the burial guidelines are obviously then the key points during Ebola, at which there are a set of guidelines around which various different people with professional backgrounds, from religious side, from the health side, etc., could come together and put something in place that was used and would make a difference. Now, one of my questions, and Fabian, I guess I don't expect you to have the answer because it's quite a broad question, is from Ebola, we saw that those guidelines were used. My question about the current WHO guidelines, they also have guidelines on safe and dignified burials. There's the general guidelines for FBOs. They have this risk management assessment tool and decision tree. They had guidelines for safe Ramadan practices as well. How much those are actually being used? And I guess that's going to be a question that we can look back on and monitor over time. From what we've been aware of within these WHO calls, they don't particularly have a monitoring system that's understanding how those guidelines are being used right now. It's more anecdotal evidence, and that I know, for example, how we've recommended them and put them in other guidelines, but and how people are referring back to them. And you make reference at the end of the article, for example, about a specific case where the WHO guidelines acted as the normative example and the kind of ultimate reference point when there were potential conflicts between local religious communities, the national guidelines, and then the kind of international guidelines, and the WHO guidelines were the ones they fell back on in that case. So that was a really interesting example to me that I hadn't heard of before, that I thought, yes, if we can just hear about that many, many more times over, this is where we're going to see more about the impact of the WHO guidelines at the moment. And another area that came out to me is this idea of cultural mediation and culture brokers. So it's about finding these key people that can talk all the different languages at the same time. It makes me really reflect on this group of people that you've just been talking about that have been involved in faith in HIV, faith in Ebola, and now faith in COVID, who are bringing the experience from time to time. And I think there's a lot of, we know who some of the kind of international experts are in this area. But then I'm also again wondering about the culture brokers in different countries, in different regions, in different localities, and the fact that I think that the current engagement with WHO seems to be quite high level, and I wonder a little bit more about how how there can be this bridge between biomedical and religious worlds that were in the example from Ebola, clearly pointed out by the example of Julien Anoko, I think the anthropologist that you make reference to, who was immediately involved in trying to bridge that gap by negotiating a space for a religious leader to come into a funeral process, etc. And so I'm just aware of these kind of different levels of cultural mediation and cultural brokerage, bridging between worlds. And again, maybe this is something that will come out in due course, but it's just, spiraling a lot of different research questions, perhaps for the future, about how, again, these WHO guidelines are actually being used in practice. It's absolutely fascinating, that stat that I haven't seen before from that paper, that the safe and dignified burial guidelines reduced mortality from, well, they give 5% to 35%, I think, or something. So it's quite a wide range. They're obviously not exactly sure, but even, I don't think, one of the things I've noticed with this COVID time is that there was a big rush to produce guidelines, and perhaps other people on the call will also, want to talk about this. And the fact that there are just so many guidelines at the moment, I can't see any one guideline being as influential to that position that we could make a statement that it's reducing even 5% mortality from a guideline is truly remarkable for the impact of the guideline, I'd say. I'm interested in thinking about the WHO guidelines in relation to all the guidelines out there. And again, are we coming back to this place where the WHO guidelines represent this kind of normative standard, or are they weakened by the fact that there are now so many other guidelines out there and people are looking to the guidelines of their organization or the guidelines of their religious community, etc. I'll stop there and ask if there are any other questions, but I wanted to just, you didn't mention as well that you've had your COVID spiritual care website. So I just wanted to give you a moment potentially to talk about that. That it might also be something that is of interest to this group, and the work that you've done there. So that's all from me. While Fabian's maybe looking at getting that link up for us or something like that, are there any other questions to the group? This is completely open discussion, so please just unmute and ask your question. and we can get discussing. I'm very interested to hear other people's thoughts about the WHO guidelines, the connection to Ebola guidelines, the connection to other guidelines, etc.
Can I jump in?
Katie, please.
Yeah, I actually, what you said, Olivia, and was already kind of the question bubbling in my head after Fabian's presentation that I would love to hear more thoughts on is the question of how things are being monitored. I've been having some conversations with our health team at World Vision this week about getting better data about faith and health, and they kind of came back to me saying, well, we know that faith and religion has a link to health, and so obviously, like, we know this and we should be monitoring it. But then when I started kind of diving a bit into what they meant by that, I felt like everything that I've seen says, yes, faith and spirituality matter. And yet when it comes to how or what exactly it is that we're trying to measure or track, I'm feeling a bit lost, actually, in terms of trying to figure out how we get past the, yes, we're engaging with faith, and how we're engaging with faith and how we're measuring the ways or the effectiveness of different ways of engaging with faith. So I'd love to hear any thoughts down that rabbit trail.
Thanks, Katie. Yeah. Well, maybe Fabian, if we've already thrown a bunch of questions at you while other people are thinking of their questions, if there's anything you'd like to respond on.
Yeah, I think those three themes which have come up, the burials and generally dying, and the problem of evidence, and what exactly is the value of guidelines. I think that is very, very important, and it really boils down to that, I think. Let me start with the burials. Dying is usually the one moment where, doctors all over the world recognize that there may be a relevance of spirituality. And so palliative care, is really where, usually, okay, if you die, let's call it a chaplain. So within that kind of very confined, narrow confines, there is, I think, fairly good recognition of the importance of religion to health, when health is basically done and you're dying. But, as we probably, all of us have a strong inkling, which is why we're all here, is that the relevance is much, much broader. But how exactly this relevance plays out is very difficult to pin down. And if I understand correctly, one of the tasks, the joint learning initiative has taken for itself is to exactly document what FBOs are doing, which is cutting right to the heart of this problematic, because we all know it's important, but we don't know exactly how. I think one very obvious way in which religious beliefs are making a difference in COVID-19 is that people have lost trust in medical institutions, specifically in the WHO, but more generally in medicine. There has been a kind of groundswell going on for the past years about, vaccinations and many kind of topics which used to be very fringe, but now have moved into the mainstream and connected to things, like 5G, ideas which were previously kind of marginal and like recognized as conspiracies, now are very, very broad. Even in Switzerland, it's very broadly circulated. And so people have lost trust and have lost faith in governments, also related to, the whole disastrous political developments of recent years. And there's been an absolute loss of trust in institutions, in democratic institutions. And so people come up with their own explanations. And in situations like these, it is, I think, religious leaders or spiritual ideas which have more authority and which really, where people still trust. And, you know, you can also say that some of these conspiracy theories, if you want to call them, say about, you know, Bill Gates and microchips and vaccinations, all these things which you're hearing everywhere, you know, they're also sometimes border on the esoteric or on the spiritual. So there is, in fact, you know, people making their own sense of these developments using quasi-religious or spiritual ideas. And so I think when science has lost and politics have lost their credibility, people turn to religion and turn to what they feel in their hearts and what people say whom deeply inspire them. So I think it is here where the influence of religious leaders on COVID-19 behavior is really, really big, potentially, you know. I mean, another example is just imagine if the pilgrimage to Mecca had not been cancelled. And imagine if that had turned into a super spreading event. I mean, there would be an absolute massive, massive cluster now among Muslim communities all over the world, and it would just be unbelievably big. And another relevance, of course, is also in the Korean church, the Shincheonji, if I pronounce it correctly, church in South Korea, and some religious communities in Iran, which is where the virus spread very quickly after it got out of China. And this was also a key event which brought the importance of religions to the attention of WHO. So, you know, very, very early on, when it came to writing these guidelines, there was the observation of the spread in South Korea and Iran.
Thanks, yeah.
Yes?
Well, I was just going to say the COVID spiritual care, if you wanted to speak on that.
Yes. Okay, let me just say a few words on the guidelines then. You know, there is an absolute guideline fatigue, guideline overkill. I'm part of this. We've also created guidelines. And in fact, I wrote this article before WHO had released its own guidelines. And I'd written this article just based on Ebola. And I looked at Ebola and I said, wow, there really needs to be something like it was done for Ebola. And I submitted the article like this. And by the time I submitted it, WHO had come out with its own guidelines. But by that time, we at the University of Zurich had already created guidelines working with the pastoral care and chaplaincy, healthcare chaplaincy communities, because they didn't know how to deal with COVID-19 cases. And so it came very early for a WHO document. It was very, very quickly done. At the same time, by the time it came out, there were already so many guidelines. And at times it almost felt like writing guidelines is almost like expresses a certain sense of helplessness. Like, you know, what can we do? You know, wow, I mean, let's write a guideline. Let's write a guideline, you know, because what else can you do? You know, but then what exactly is done with these guidelines is, you know, I mean, cynical people might say this is, and I've spoken to a lot of people involved in the consultation in this guideline, WHO guidelines, and, you know, at least one of them said, you know, this is just a paper, you know, this is just something WHO has done for itself to, you know, and forget about it, basically, you know. And so I think there's a very big need to show cases where people have actually changed their behavior because their faith community has recommended people to do that. And WHO, as I understand it, is now, in fact, thinking about how to, you know, maybe write a report or a conference or something where people share these best practices and share how this actually made a difference. And yeah, so much for burial and evidence and guidelines. Yeah.
Thanks. Any other discussion points from the group? Reflections? Okay. So the COVID and spiritual care, Fabian, if you want to just take a minute.
Well, this really was like a lot during this crisis. It was done very quickly because we're a group of chaplaincy under the professorship of spiritual care. So spiritual care as a discipline, as a profession, also has an academic field to it, which is really looking at how do chaplains provide care in medical settings. And so we work with within Europe, and specifically in German-speaking Europe, we work with the people who are in the hospitals, who are called when people are suffering, and it's not a psychiatric problem. You know, it's not a psychological problem, but it's just a problem of bereavement, of existential crisis. You know, getting a terrible diagnosis, you know, loneliness. So most hospitals have chaplains. And so this is the profession. And these people are really at the forefront of COVID-19 and religion within the hospital setting. You know, they are the people who hear all the, you know, the pain and suffering on the hospital ward, because doctors don't have time for that. And nurses, you know, nurses are trained also often for intercultural competency and spiritual competency, but they also have, you know, a lot to do. And so it is chaplains who really go there, and their job is really to hear people and sometimes to provide rituals as well. And so there was, you know, a big question. Yeah, I mean, burials was one thing. So with Islamic communities in Switzerland, there was a question, you know, can you touch dead bodies who died of COVID-19? Can you wash them? Because Ebola bodies you certainly could not wash. There was a huge problem. But, you know, with COVID-19, it's not a hemorrhagic disease. So it seems to be okay. So there, so out of this, we consulted with all these chaplains in Europe, and, you know, asked, you know, what are the issues, and what kind of best practices should we advocate? You know, I mean, are you even allowed to go in there to visit? You know, what kind of hygiene rules? You know, what about, you know, using Zoom meetings and like non-contact adaptations? And out of that, we then made a website, and we wrote these guidelines and circulated them. And we had a lot of visitors, and at the peak we had, you know, 500-600 visitors per day of people who came on this covid-spiritualcare.com, and we're looking for guidance on how to act in this situation. Yeah. And then they released their guidelines, and then I rewrote the article. And
thanks. And I see Katie has put some more in the chat about surveying faith leaders and where they're getting their information from, and it's mostly national sources rather than humanitarian actors. So yeah, I think we've been working on guidelines in project we have with UNICEF, and we've ended up, you know, the initial WHO guidelines on adapting gatherings and practices are relevant, but we've also ended up doing guidelines on communication and misinformation, stigma and discrimination, you know, different vulnerabilities, now recovery of services and reopening, the links to gender-based violence and violence against children, etc. So there's just so much. I think as we've seen the guidelines progress, you know, the initial rush to guideline was around just adapting religious practices and gatherings. and guidelines are now diversifying out to all of the other niche areas in which organizations are working, or they see as an important topic. I mean, I think this is obviously very much like an ongoing question now, and we're going to be talking about it for many years to come, about how we're adapting these current guidelines, whether they need to be changed already because there's new information that's come out. This is going to be something that well, certainly JLI, we're paying attention to. I'm sure you are as well, Fabian, and various others as we go along. I mean, I think that Katie's question about how we're measuring this is still very much pending and probably varies from organization to organization. I know certainly that within the work we're doing with UNICEF, the guides alone, we don't feel are going to be sufficient, and we're following up with webinars and different ways to bring those guidelines to life for people, and more monitoring how people are participating in those events rather than just the guidelines alone, because they're just PDF documents after all, and we all have a lot of those floating around. We've got just a few minutes left if possible. I'll just leave open if there's anyone else that has kind of a final burning question or point that they would like, or comment they would like to make about this area.
I think I have one question, but yeah, I don't know whether it's relevant, but you were talking also in the article about how religious, how the WHO did guidelines for Mecca and for religious practices, and you talked about this in your talk as well. What has been troubling me for the last month has been still how those guidelines can be adapted in other local contexts, such as in my case, Mozambique, and that some of those guidelines might not be as applicable for some local contexts. I think there has been some discussion going on already, and some articles claiming that basically, one of the most social distancing and staying at home is not applicable or applicable in contexts such as sub-Saharan Africa. And I was wondering whether you know more about maybe initiatives by religious actors that try to kind of work with the WHO on those issues to sensitize more about adaptability to the local context as such, or whether there's like initiatives by religious faith groups to try to make those guidelines more suitable for more, let's say, context of the global south. That makes sense. Sure.
Yeah, thank you. I think one thing is that the guidelines themselves are in a way guidelines for religious leaders. So it is not speaking directly to, the people, but it is speaking to kind of a medium level. And so religious leaders are, asked to be creative, to craft their own messages, to adapt these the public health messages to their own community. So this is in fact, not a finished document in that sense, that it actually asks these leaders to really take initiative as well. I mean, for example, one thing that really baffled me was, there is the encouragement to integrate this kind of COVID-19 public health advice into, religious, say, sermons and things like that. So I think WHO on one hand is very aware that it can't do everything for everyone. So it speaks to the leaders of these communities. And the other thing also is that WHO, as I experience it, is really very, very open. And very, very much hoping that people will approach the institution and say, look, this is really a specific concrete problem, and we don't know how to deal with it, or how should we deal with it. I mean, like I said, Dr. Tedros at this webinar, was very explicit. This is not just about religions, but it is about the civil society in general. WHO must respond to civil society. It cannot be just talking to ministries of health and be a political instrument of the World Health Assembly. It must respond to the people, and that I think it has recognized goes through civil societies organizations. So there is a very sincere, I think, attempt to find dialogue to deal with the real problems. Having said that, you don't have to reinvent the wheel, because the public health advice is more or less the same. I mean, it changes as well, like the advice on whether or not to wear masks, has, let's say, evolved. So there's a certain evolution of let's say, the science or whatever WHO deems appropriate at a given moment. But by and large, washing hands, keeping distance, these kind of things they don't change massively. It's just how infectious diseases work. And so it is a matter of, I personally, I think, my hope is not for guidelines to change the world. I do think they can make an enormous difference if, for example, pilgrimage to Mecca, follows these guidelines. It can make a really inconceivable difference. However, I think the real potential is that it exactly demonstrates to the public the willingness of WHO to engage directly with the needs of the people. I think that is the larger kind of hope behind these guidelines, that people recognize, hey, this is an institution which we finance through our taxes, through our national governments, who then make contributions, so that it is working for us, it is in our interest, and it is the best of our minds, working, it has been benevolent intentions, and we're doing all of our world community a favor if we work together in this. And I think if this is really what I hope that this dialogue and this outreach can bring about. So at the moment, this is maybe an effect of these guidelines, but I hope in a longer term, there will be other ways in which people are starting to realize that we all need to work together to handle these crises. Yeah, so kind of a plea on my side, I guess, not to get all too bogged down in the technicalities of the local implementations. Yeah.
Okay, great. Thank you very much, Fabian. I mean, I think, yeah, there's going to be many different opinions around that subject, I guess. But I think for now, well, what we've seen is that we should take some encouragement from the fact, as you say, WHO, opening up to civil society, to faith engagement, to, listening a little bit more, which is an encouragement, especially in comparison to what you've seen in the archives from the past decades. Your preprint is available to share, so please, to anyone on this call, if there's anyone else that would like to read about this, you have the PDF now. And thank you so much, Fabian, for giving your time and insights and telling us a bit more about your research in this area today. For this group next month, we are considering just taking a pause for August because people start being away, but we'll circulate that via email, what we're going to do and when the next session will be. So thank you very much, everyone, for joining, and thank you again to Fabian.
Thank you all very much for the invitation. Glad to be part of it again.
Yes, you're very welcome.
Follow up on anything, and we've got this book coming out if you want to know more about the archival work on this topic.
Sure, absolutely. Okay, thank you very much, everyone. Bye.
Bye-bye.